Our first guest is just a fantastic get for our program and a wonderful human being. Dr. Lenore Asbel is an infectious disease specialist in Philadelphia, Pennsylvania. She's been in practice for more than 20 years. Generally, infectious disease specialists deal with a broad array of diseases caused by germs, ranging from flu to hospital-acquired infections to pneumonia, and of course, of recent COVID-19. Dr. Asbel, thank you so much for being with us. Hold on, you're muted. I apologize.
Thank you for inviting me today.
Terrific.
You hear me?
Absolutely.
Okay, good.
Thank you so much. Dr. Asbel, today's program is called JA Inspire, and I want to start with the inspiration question if I can. What compelled you to pursue a career in medicine?
So I've been thinking about this a lot in preparation for this, and I would say, probably unlike many of your students, in the era when I grew up, choice of what you were going to do was very directed by parents. I think I now have children who are only a little bit older than the students who are on here, and I was directed. I was basically, it was explained to me as I was growing up that I could do anything I wanted after I finished my basic education, but that included medical school. So while there was a big push to be a physician, what I did with that was up to me. And probably had you asked me 20 years before I went, or 10 years before I went to medical school, if I ever thought I would end up doing what I was doing, I would say absolutely not. So I think one of the things that the speaker who did the introduction said is be willing to pivot. And so while I knew I was going to be a doctor, it was pretty much a, guided thing.
Foregone conclusion, yeah.
Yeah, the foregone conclusion. How I dealt with that and what I did with that was really the trajectory that I was able to control. So when I started and when I thought about what I was going to do, I really thought I was going to work in a job after going to medical school where I worked in rehabilitation medicine. And I started medical school really thinking I knew what I wanted to do, and I was going to work at a rehabilitation center and work with people who had had either strokes or other illnesses that had caused them to need physical rehabilitation. And a lot of that was identified because of experiences I had, friends, and as most people, you know what you know. And I had experiences with people who had had in childhood strokes and had been in long-term rehab facilities. And I was sure at that time that that was what I wanted to do. But I will tell you that both being an undergrad and then you follow that with medical school, when you go to medical school and you learn about all of the different things that I really had very little idea about, the broad spectrum of things that physicians do. Many of you know your physicians because you go to them, you see them for when you're well visits growing up, your pediatrician, you know what pediatricians do, you know what cardiologists do. But I had really very little exposure to sort of the broader context of what you can be as a physician and all of the subspecialties within that. And so when I was in medical school, really the broadest exposure that I learned about was internal medicine. I felt that it had the ability to do so many different things. And it really was learning about complete systems and adult medicine. And so as I went through medical school, I decided that I would do a residency in internal medicine, giving me a huge number of other specialties within that I could do. So when you go to medical school, 4 years, you apply for a residency, and there are some subspecialties. So you can do internal medicine, family medicine, surgery. So I just decided, like I said, to do internal medicine, knowing that for me, it would give the broad spectrum of things that I might be interested in. And at that time,
pretty wide open at that point.
Exactly. It opened a huge amount of things for me. One of the things that I would also say is that even at that point, what I thought I wanted to do, so I had already decided, okay, rehab medicine, I've learned a lot. I've done a bunch of rotations. I really am interested in sort of the thought processes and diagnostics that go into internal medicine. And when I started medicine, I thought for sure, now I had a lot of other life experiences. I was like, gastroenterology, that's for me. So again, I did my internal medicine rotations, and you do a lot of inpatient medicine. You see patients who are always admitted to the hospital. They're always, as a resident, somebody else's patient on the outside, your patient to take care of on the inside. And you learn a wide swath of medicine. You spend time in ICUs, on the general medicine floor, on the gastroenterology service. And one of the services that I rotated through was infectious diseases. And as I was rotating through the infectious disease service, what I found out was that they were the specialists who read the medical chart from beginning to end. And they were really, it was truly like an investigative thing. A lot of diagnostics, a lot of finding out what the organism was, the pathology. And for me, that was totally fascinating. We went to the lab. It was a mix of seeing the patients, listening to their story, getting their travel history, finding out all about them, and then going to the lab, looking at the organism, how it grew on the plate, looking at it under the microscope. And all of that led me to want to become an infectious disease physician. And I'll say again, I started my infectious disease fellowship. And when I started my infectious disease fellowship, if you had told me that I was going to end up in public health, I probably would have looked at you like, probably no way. But again, there was this pivot. I rotated through and I spent a lot of time doing different rotations, doing consults in the ICU.
Dr. Asbel, can you speak to what you mean by public health and how it's differentiated from other healthcare careers?
Sure. So one of the things, I was doing infectious diseases, and then I did a rotation in an STD clinic. I now work for the health department. Now, public health is incredibly broad in what we do. And in the city of Philadelphia in particular, and in many places, there's the caring for patients part of medicine and the caring for populations. And most of what public health is about is caring for populations. And there are many ways to do that. So public health includes, and now we all know about it, tracking diseases, identifying new infections and making sure that the community is aware of new infections. I mean, COVID's a great example of this. Doing screenings, mass screenings, so that we identify people and find out what they have. Doing surveillance. So now my specialty within public health is related to sexually transmitted diseases. But there's, surveillance about lung disease related to cigarette smoking, chronic disease surveillance. All of that is population health, is public health. And it's really identifying and sort of the difference. Within public health, I would also say that there are ways to sort of bifurcate that. And so in order to affect public health and population health, you also have to have an effect on individuals. So when we—
the macro and the micro.
Correct. And so when you think about this, like COVID's a great example of this, right? It's in order to affect the population, patients who are infected, right, need to isolate themselves. And many of you may have heard, if you're watching the news now, about contact tracers, right? So somebody has an infection. How do we figure out and how do we keep them from spreading it to somebody else? How do we identify who the likely people are to also be infected? So the health department, the PA health department, the city of Philadelphia, many other health departments are currently hiring and using contact tracers. In my world, in the sexually transmitted diseases world of infectious disease, we've been using contact tracing as a method of going from the individual to the population for a very long time. So we identify patients who have an infection, and then we move from that to find out who else might have it. And when you treat those patients, so COVID isn't something that we have treatment for in the same way as some bacterial diseases, but we find other ways to decrease their likelihood of spreading something to the community.
So, Dr. Asbel, we have about a minute left, and I would love to end with this particular question, if I may. You're traveled through time, and you've got 17-year-old Lenore Asbel by the shoulders. What do you tell her?
Be open to different choices. Have something you're interested in. Follow what you're interested in, but listen to the people around you and let it take you where it takes you.
Dr. Asbel, thank you so very much for being with us.
Thank you. Thank you for inviting me today.
Please stay safe with our best wishes.
Thank you.